I'm Dr. Rick Morris, and I'm the director of the Morris Spinal Stenosis and Disc Herniation Center. And if you have these conditions, you know that both of these are pretty disabling, and in fact, it ruins the quality of your life. Spinal stenosis usually makes it very hard to walk and to stand, and eventually it can get so bad you have to use a walker or a cane or sit down every few feet. Disc herniations are usually just the opposite. They usually make it harder to sit down, and just driving can be excruciating. And the pain can shoot down your leg and create sciatica. And many of our patients have both of these. So if you have these, you know what I'm talking about. And it is depressing, and it changes your whole life. Our office developed an approach to treat both of these conditions that we teach to doctors all over the country, and we're preparing to publish a study on it. It had very good results, extremely good results, especially compared to conventional treatment. Now, you know what conventional treatment is. That would be physical therapy, chiropractic, injections, epidurals, medications, narcotics, and sometimes even surgery. Our approach had a successful outcome on 90% of our patients that we accepted for treatment. Now, unfortunately, we can't accept everyone for this treatment. We only accept the patients we really believe it's going to work, and presently we have about a 90% success rate, meaning that these patients went from a position where they're nearly completely disabled or very limited in their ability to stand and walk and sit, to the point where they're usually nearly completely off their medication or completely off their medication, and far more active and be able to stand and walk much longer. And you're going to meet many of these patients further on in this DVD, and I want to see if you're similar to those patients. If you are, then we might be able to help you. Let's take a moment to understand what spinal stenosis and disc herniations are. First, let's look at the spine. This is the front, this is the back of the spine. This is the disc, these are the vertebrae themselves, this is the spinal nerve, and this is the canal which houses the spinal cord. A disc herniation is when the disc bulges either into the spinal nerve or into the spinal canal, hitting this spinal canal or spinal cord area. When it goes into the nerve, the pain usually shoots down your leg, and we often call this sciatica when it goes down the back of the leg or into the foot. Spinal stenosis occurs where the canal is narrowed. This is the canal right here, and it's usually narrowed due to thickening of the ligaments inside the canal, or a disc that herniates into the canal, or a disc that degenerates, which happens as we get older and it gets smaller, so it compresses the canal together, or if the alignment of the spine twists or turns just a bit, you can see how it would make that canal become smaller as well. Our center uses a combination of all medical approaches, including physical therapy, chiropractic, rehabilitation, and strengthening specifically designed for these conditions, medicine injections when they're necessary, and non-surgical spinal decompression. Let's take a look at the machine. This is the DRX 9000 spinal disc decompression unit, and what it is a sophisticated form of traction, meaning that the person lies here, the body stabilized by putting their arms around these bars and by a chest piece that's held at the other end of the table, as well as a bottom piece that's held and connected to the table right here, to the computer. And what happens is we move this device up and down so that we can isolate specifically the disc or the segment involved, so we can separate that one segment specifically. And the computer allows us to pull the patient apart in just a subtle way that is, if they tighten up at all, it relaxes. And it makes this decision 17 times a second. So therefore you can get significant joint decompression, because a traction is where you just pull the whole body apart, and when you pull on somebody they have a tendency of tightening. With decompression, it reads what you're doing every split second, and if you tighten, it relaxes until eventually your body relaxes completely so that your joint further separates. And the joint separation is usually about twice as much as you would get from traction. And because of these angulations, we can actually be very specific to isolate the segment that we want. On a personal note, I suffered 3 disc herniations and 2 disc tears, and I had this for well over 10 years. Previously, I was an athlete who did the Ironman triathlon in Hawaii and many other track events. And when I suffered this injury, it became hard to work, it became hard to live, it was depressing, and I understand what you're talking about. I went through all kinds of treatment protocols, from medical doctors to chiropractic doctors to faith healers to religion to surgery, and none of which helped me, or none of which helped me significantly. Some even made it worse. So when I eventually found an answer that helped me to be much, much better, I changed my whole practice. My life purpose was no longer to help an NBA player get back to the court more quickly. Instead, it was to help people like me who had been through everything and were told that they just would have to live with it, which is an impossible thing to do and have a good life. So we asked some of our patients to tell their stories, their past diagnoses, past treatments and symptoms, and their experiences with this new treatment. And I asked them honestly to come forward and just tell their story so that you can understand it and see if it applied to you. I know that you've heard testimonials for everything from hair tonic to acne preparations, but these people are definitely not actors, and the cameraman was definitely not a professional cameraman, as you'll see when you hear the stories.